and thank you for joining us for the 49th Annual AAKP National Patient Meeting. We hope you have been enjoying the sessions. My name is Erin, Kahle, and I am AAKP's Deputy Director. I have had the absolute honor of being part of AAKP for over 7 years. And over that time, I've been able to work closely with AAKP's Executive Director and Executive Board leadership to stand up AAKP's Center for Patient Engagement and Advocacy and our Center for Patient Research and Education. These centers were founded to serve as a rapid fulfillment hub for requests for kidney patient experts originating from government, academia, medical device manufacturers, and the pharmaceutical industry. Some of these requests include patient representation on technical expert panels, advisory boards, as well as various research and clinical trial initiatives. Since 2020, AAKP has been dedicated to bringing patients a variety of training sessions that provide practical skills they can use to make an impact. To date, AAKP has over 20 skills training sessions, such as being effective with reporters, how to talk to elected officials and staff, maximizing your social media platforms for advocacy purposes, how to be an effective participant in clinical trials, and how to effectively collaborate with researchers and principal investigators in research study opportunities. These sessions are all available on demand and at no charge on our YouTube channel. With that, it is my pleasure to introduce our next Advocacy and Engagement training session, Beyond the Hill Day. Key tips for building a relationship with your congressional and legislative representatives. This session is proudly supported by an educational donation from Ardelex. We are excited to host this session as part of AAKP's ongoing training effort to provide you with the practical skills and knowledge to be effective in advocacy efforts as you engage with elected officials. AAKP's history is steeped in advocacy, with a former board member, Shep Glazer, dialyzing on the floor of Congress to demonstrate the impacts of kidney failure and the life-saving treatment of dialysis, which supported the passage of the Medicare ESRD program and was intended as a bridge to transplantation. Since then, for over 50 years, AAKP has been a leading independent voice of kidney patients and a trusted source for federal agencies and elected officials on both sides of the aisle to provide an unbiased perspective on current and emerging legislation. Today's session will equip you with the skills needed to establish and maintain a substantive relationship with your congressional and legislative representatives beyond participating in an Advocacy Hill Day. The information you will learn today about the importance of relationship building and how to go about it will help you become the go-to person for these elected officials and their staffers on kidney issues. Today, we are honored to welcome dedicated kidney warriors and AAKP ambassadors, Dean Armandroff, Dale Rogers, and Terry Litchfield. Dean's decorated career has spanned several decades of service in national public policy and medical affairs, including working for the American Medical Association as a regional political director, where he oversaw their political action committees and engaged with a broad, bipartisan coalition of lawmakers to share concerns for the integrity of the doctor and patient relationship, patient care choice, and policies that support timely access and payment for new medical innovations. Dean is currently on hemodialysis while awaiting a transplant, and he is a passionate AAKP ambassador from Virginia. Dean, I'll turn the presentation over to you.
Thanks, Erin. I really appreciate having the opportunity to speak here today at the Patients Forum. It's really an honor to talk to all of you fellow patients, activists, people who really care about people with kidney disease. That's something I'm obviously very passionate about, being a patient myself. Let me quickly tell you a little bit about me. I worked for years in politics and advocacy and nonprofits, and learned a lot about how to tell other people's stories And now, in addition to that, I'm also telling my own story. For the last 3 years, I've been on a kidney journey, like all of you have, from having symptoms to being diagnosed to trying to stave off dialysis for as long as possible, and unfortunately now being on dialysis and waiting for a transplant. So I think we can all relate to each other, that these are experiences we've all shared. And one of the things we're going to talk about today is the importance of telling your story. And so I thought it was good for me to tell my story a little bit. And of course, like everybody, I have a lot to live for. I have a great family, a young kid, 9-year-old boy, a great wife, lots of friends, lots of other family. I've been really blessed in so many ways. And so I try to look at kidney disease through that spectrum of, sure, it's a challenge, and sure, there's really tough days, but there's also a lot of great things to live for. And I know most patients, especially the activists that are here today, feel the same way. And I think we have a chance to be the voice, not just for ourselves, but for others that can't do it themselves. People who are more sick, people who are so busy making a living or taking care of their family that they can't get involved in advocacy. So I feel we're not just having our voices, we're amplifying the voices of others. So the panel is about advocacy beyond the Hill visit. And of course, we do the Hill visits as a group. Well, when we can, during COVID, we couldn't, but now we can. And those are fantastic tools. It shows a show of strength. It shows a unify of message when you have hundreds of people going in and saying the same thing to their members of Congress and senators. But there's a second part to it, and that's called grassroots advocacy or grassroots lobbying. What is it? It's people talking to the legislators in their community. It's more effective than just going to the Hill. It's really a 1-2 punch with the paid lobbyists and with the Hill visits. And it shows the legislators and their staff that there's real people behind these issues. These issues don't just exist on paper or as budget numbers or payment numbers from Medicare or Medicaid, but there's real people living these issues. And that's really important, to put that human face on an abstract issue. It makes the issue also relevant to the legislator for their community. It's not something far away. It's not those other people. It's us. And that's really important too. And the goal, of course, is to influence the legislators or rulemaking. And what I mean by rulemaking is so much of healthcare isn't outlined by Congress. It's done by either Center for Medicare and Medicaid Services, the Department of Health and Human Services, the Veterans Administration, where they're passing rules about payment, about how procedures are done, about who does procedures, about basically everything that we do. The legislation that's passed is quite vague and empowers either CMS or the HHS department to make the rules. So rulemaking can be affected by letter writing and speaking at hearings, but it also be affected by legislators. Congressmen definitely weigh in on the rulemaking, and also will often tell the department, this is what we really intended when we passed that legislation. So it's a two-part thing. There's the legislation itself and the subsequent rulemaking. Why do we do it? First of all, it's people power. We want to show the world that kidney patients have a voice, have a story, are willing to fight for what they believe in, and are worth fighting for. Also, it's the power of storytelling. Again, like I said earlier, putting a face with these abstract issues of payments and budgets and studies. Really important to have that human face on it. And as I said earlier too, it's the 1-2 punch with the lobbying. It's not enough anymore in congressional politics to just have professional lobbyists. You need to push from every angle, whether it means mobilizing your people, paid advertising, traditional lobbying on the Hill. And then lastly, the main reason for doing it, of course, is it works. I've seen this firsthand through my career, both working in a congressional office as a district aide and working as an advocate. It works. People pay attention, people listen, and they really do respond when it's people from their own community coming in to talk to them. So what do we mean when we say grassroots advocacy? What are the tactics? What are we trying to do? First of all, it's mobilizing people like we're doing today. We got a bunch of people together that have a common cause, that are interested in the same thing and want to affect change. That's exactly the key formula for grassroots advocacy. Secondly, we want to educate leaders. They want to learn and meet with people to get more information and to get firsthand information, not just information from either federal bureaucrats or from people who testify before committee. So education. The next thing is media outreach. We can help to shape the coverage of issues regarding kidney disease and healthcare in general. And that's another indirect way to influence legislators and influence policymakers is through the media. So again, it's not just a 1-2 punch, it's really a 1-3 punch where you have professional lobbyists, grassroots lobbyists, and hopefully information flowing in from our work with the media. Letter writing campaigns, another tactic. Although letters to the editor and things like that aren't nearly as important as they were because print journalism isn't as important as it was, they still help to shape opinion. So if you see an article about healthcare or about kidney disease or about transplant that you have an opinion about, write into that paper and tell them how you feel, what the AAKP's position is on that. Same thing with websites, add comments. It's very important, again, to get our voice out in every single medium. Public meetings and town halls are a great way to influence a legislator and policymakers. I really, really think this is an important thing. Congressmen all have town hall meetings. Some are virtual, some are in person, and they usually put the schedule up on their website or in their constituent mailings that they send out will send the information. Sometimes they're very calm and orderly. Sometimes they're a zoo, depending on exactly what's going on and who the member is. But it's an opportunity to speak one-on-one with the member. And there's usually media there, of course, and there's other people there that are also active in the community and are interested in public affairs. So it's a great chance to get our message out. And it's also the first step towards building that relationship with the member. I just did a project for in a professional capacity to get people to do meetings during the August recess with their members of Congress, whether it was a town hall meeting or a meeting at their district office. And we were able to organize about 100 meetings around the country, which is incredible. And I thought it was pretty good. And it was a chance to really get some one-on-one time with either staff or with members, and also just to raise the issue. So keep that in mind when you hear about town hall meetings. Build relationships. Ultimately, this is a people business. You want to be a person that they know, that they like, that they want to talk to. And that's the essence of building a relationship. If you're not confrontational, if you're a resource, if you're helpful, give them information that they need, you will be a person that they want to have an ongoing dialogue and relationship with. Be a resource, which is what I just said. I've known advocates that have become so valuable to a member of Congress that whenever there's a key vote on health care or a key vote related to their issue specifically, their staff reaches out, and sometimes the member themselves reach out. And you definitely see it in other issues too. I know, for example, regarding like issues in the Middle East, AIPAC has members of their organization that work with members of Congress to the point where members of Congress will say, hey, wait a minute, hold on, let me call my AIPAC guy before we vote on this. We want to get it to the point where somebody says, hey, let me call my kidney person from the district before we vote on this or before we put up this amendment or whatever. That would be the most ultimate relationship where you're a resource to the point where they contact you before voting. Leave behinds, another important tactic in grassroots lobbying. What I mean by that is leaving behind a one-page summary of what you're talking about. And in a town hall meeting, all you do is you ask, after you're done speaking, you say, Congressman, may I bring you up my information, on for you, and you walk up and hand the one pager. I highly recommend always having a concise one pager that summarizes what you're asking for, whether it be a certain vote or a certain to weigh in on a rulemaking process or whatever it is. The information is often available on the AAKP website. There's a lot of information about advocacy issues and the wording for things. But if there's something you want to talk to a member about and you're not 100% sure what to put in your leave behind, just contact us, the office, and we'll give you information. The reason I like the leave behind so much is I've seen it in my own experience, that these things really take on a life of their own. It sits in somebody's file, and then when there's a healthcare aide hired and they need something, they get the file. And then a year later, they're looking up information and bang, our document pops out at them. And I've seen it pass from aide to aide, from office to office. It's really quite amazing. And so the leave behind is a really important tool. Document the visits, the calls, and what you're doing on social media. It's a way to amplify your actions. And what I mean by that is you go to a town hall meeting, you get a picture, you put it up on social media and say, hey, here's what I did last night. I went to Congressman so-and-so's town hall meeting. I spoke about the importance of transplant, and the likelihood that someone who sees that then online and they share it or they tell other people is really a way to amplify your voice. Have a concise ask. This is very important. I've been in a lot of meetings where people come in and have an ask. What I mean by ask is they have a goal of what they're trying to get the member to do, but then they divert into a million other tangents, and that's not helpful. You want to have it be a very focused meeting, very focused talk at a town hall meeting, for example, and you want to ask for one thing. Will you support this bill? Will you reach out to HHS about this rule? And it should be a kind of almost like a back of an index card kind of ask. If it's too complicated, too much jargon, etc., it's not going to work. And so kind of think that through before your meeting and think about how you can very concisely ask. Again, we can help you at AAKP to do that the right way. And lastly, tell your story. As I said at the beginning, storytelling is super powerful in all areas. No one wants to hear facts and figures and statistics. Talk about, getting someone's eyes to glaze over. But if you tell them your story, make it human, tell them the consequences of what's happening with kidney disease, tell them your feelings, tell them about other people you've met along your journey, let's say at dialysis, and what's happening with them. This is very, very compelling. And the members of Congress and their staff will remember that. And that's always the best, movies tell a really great story. The best books, of course, tell a really great story. Well, so does the best advocacy efforts tell a good story. And don't think your story isn't compelling or isn't great, because it is. What we've had to go through as patients already is, an unbelievable story. And where we're going to go in this journey is an unbelievable story. And so you want to share that with not just policymakers, frankly, share it with as many people as possible. I want to talk about one last thing that I call the ladder of advocacy. And this is how you can get more and more involved and become a more effective and more powerful advocate. Everyone can do something, but everyone's not going to do everything. It's that simple. It's like anything in life. So you got to meet people where they are. Some people are just going to do sign an online petition or shoot an email that's pre-written to their legislator. And that's great. Other folks are going to climb that ladder and do more. They're going to go to a town hall meeting. They're going to set up a one-on-one with the congressman's staff. They're going to become a social media warrior and push kidney health, kidney solutions, transplant, etc., aggressively on social media. And the idea is, I think our goal as people who've already obviously self-identified as activists and self-identified as real believers, or you wouldn't be here today, is to move up that ladder and to not do the least possible, but to do the most possible. And look, everyone has limitations. We have health issues, we have jobs, we have family. But I think we should all leave here today saying, what is one more thing that I can do? I've already done these 2 or 3 things. What's one more thing I can do? And then in 6 months say, well, what's another thing I can do? And pretty soon we'll have a lot of people sitting at the top of that advocacy ladder. And the real goal should be to have 1 or 2 people in every congressional district who are the go-to person on kidney issues and transplant issues for that member of Congress. We're not there yet, but I really think we can get there. And that's what I mean by reaching the top of the advocacy ladder. So first of all, thank you all for your involvement. Thank you for your advocacy. Thank you for sharing this journey with me. And I wish you good health. I wish you happiness. And thank you for your involvement.
Thank you so much, Dean. I'd like to ask you a few questions. You have a background in advocacy and public affairs. How did your professional experience help or guide you when you were diagnosed with kidney disease?
Well, it's a good question because it is very interesting when all the things you've been working on professionally then become part of your personal life. But I just apply the same lessons to what worked professionally to what I'm trying to do as a patient advocate. Tell my story, which of course we just talked about in this session. Have a concise ask. Don't be all over the place, but say, hey, here's what our community needs now. And try not to take it personally. That's one of the big differences between being a patient and a professional. If I meet with somebody and they're not responsive, as a professional, you just check it off and say, okay, we'll go to the next meeting. But as a patient, it hits much more close to home. Why don't they want to help? What's going on? And so you need to not make it personal because the stakes are so high for us.
Do you have a different approach when advocating for yourself as a kidney patient versus the advocacy work you have done on a professional level?
Well, the principles are still the same. As I said, tell your story, be relatable, become a resource, etc. But of course, the stakes are much higher when it's something that affects you personally. And so, I think that it hits much more closer to home. It's more impactful, I think, to be able to say, hey, I'm here as a patient, not just as a professional advocate.
What do you think is the easiest and most effective way to build a relationship with elected officials?
Being there and showing up. You can't expect it to happen overnight. You got to do multiple things and be there. And so I recommend, as I said in my talk, working up that ladder, starting with small things and then building into being a resource to them. It's, I think Woody Allen or somebody said, 3/4 of life is showing up. I'm probably getting the quote wrong, but in advocacy, it's the same thing. Showing up, being there, being available, and they'll start to recognize you. It is a very small group of people that are available to a member of Congress that aren't just a one hit, where they write in a letter, get a response, and then go away. It's a few people. And so if you're one of those few people, you're going to really, really be able to do a lot for help the member, but also to help kidney patients.
Thank you again for joining us, Dean, and for sharing your perspective with us. Now I'd like to introduce our next speaker, Dale Rogers. Dale was diagnosed with type 1 diabetes at age 12 and hypertension as a young adult. Eventually, he needed to begin dialysis before receiving a kidney from his adopted sister and a pancreas from an unidentified donor. 9 years later, Dale resumed dialysis and waited 6 years before receiving a second kidney from an unknown deceased donor. His experience as a patient has led him to become an incredible advocate for all kidney patients, especially those who live in rural areas and may not have easy access to the resources needed to guide one along their journey with kidney disease. Dale serves as AAKP Secretary and is an ambassador from Idaho. Dale, I turn it over to you.
Thank you, Erin, for that introduction. And I'd like to hope that each one of you have found time during these different sessions to find something that you can take back to your community, that you can share with fellow patients, with family members, friends, and your congressional leaders of your communities. I have suffered from diabetes for the last 45 years, and I have been involved with kidney disease that has debilitated me in some way, fashion, or form since 1998. I've received 2 kidney transplants. I've received a pancreas transplant, and I have had numerous other medical problems that are closely related to or caused by kidney disease. Each one of us have the ability to advocate for ourselves. And then I think that once we've found the ability to advocate for ourselves, it's a calling to each one of us that we go further than just that advocating for ourselves and take it further and advocate for each other. Each one of us have an important story to tell about ourselves. But once we start advocating for others, that story gets bigger. We got to start telling the story about the people around us, the patients around us, the things that are happening, the improvements that can be made for each one of us to live a better life.
Thank you, Dale. I'd like to ask you a few questions. Can you share a little about how you first became an advocate for kidney patients? What was that first step that you took? And is that something you encourage others to do to get started?
The first step in my advocacy had to start back when I was in management. I went to this management training session that was called Managing Goal Achievement. And after I took this seminar of managing goal achievement, I found myself able to talk about things that I believed in. And it didn't matter who it was. I could speak to anybody. I just wasn't afraid. And so I think that that's one of the strongest characteristics for myself and the gift for myself that I was able to receive. And after I was able to do this, then there was things that matured later on. One of the first things that I remember being involved in advocacy, I was sitting in the dialysis chair, and we had chairs at dialysis that were just plain worn out. And I ended up having to go to physical therapy because my sciatica was hurting me so bad. And so going to physical therapy, my physical therapist talked about the chair and wanted to know about it. And these chairs were so worn out, where you sat, there was actually a hole in the chair, in the cushion, that just totally put you off balance in the chair and sitting there for long hours. And it bothered me. And so I brought it up to the manager, and she told me that there was no plans to do anything with the chairs. And so I told her that I would like to speak to the regional manager about it. She put me in contact with one of the VPs of the dialysis organization where I was going to dialysis, and I talked to them about it. And I was pretty irritated at this time, and so I was pretty vocal about how I felt about it. And after I got done, I couldn't believe it, because there were so many patients that thanked me for speaking up about it, because not only did it benefit me, but it benefited all the other patients that were in there, because these chairs were so worn out. And at that point in time, I decided, I'm not afraid to speak out, so I'm going to do something to help others. I'm going to start talking about other things that are going on. And so shortly after that, I got my second kidney transplant, and I was going back to my visits post-transplant every 2 weeks back in Seattle. And my nephrologist, Christopher Blosser, asked me if I would be willing to go to Washington, D.C. to a transplant summit for patients. And I listened to him, and he said, I know people, and I can, make some connections and make sure that you get a go. He says, you've spoke out about some stuff around here, and it's been beneficial. And I think that the kidney community could use people like you speaking out about things. And I think that each one of us has that ability to do something to advocate for others. So I went to this transplant summit, and that's where I met other people. I made two friends. One was Dave Forfang, the other was Dave White. Dave Forfang, I was sitting in the restaurant in the hotel, and he rolled in his wheelchair and pulled up to a booth, and he just started talking about kidney disease to the next table just out of the blue. And I was like, wow, there's somebody talking about problems that I have, and he doesn't even know these people. I've got to meet this guy. And so Dave and I made friends, and that was a point where I decided that I didn't need to be worried about talking to people just out of the blue, because it created awareness. All these people that didn't know about kidney disease could someday be affected. And so for me, being able to talk out and say something to just people I didn't know was a benefit. And then I connected with Dave White later at the meeting, and he was a board member for AAKP. And I said to him, if you guys ever need help, I'm available. And he said, I'll give you my business card. He gave me his business card and said, email me. And there's Erin Kahle, that is the advocacy representative for the organization, and I'll have her get back with you. Well, and it's been nothing but busy from there on out. I've been involved in different engagements, speaking with our congressional people, doing different events, and helping other patients, be involved with patient advocacy. After that point in time, it became kind of second nature for me to be involved in patient advocacy. And I just want to tell each one of you that are out there today that I encourage each one of you that if there's something that you can do, and I believe that each one of us have a gift that can engage us in being a kidney warrior, to connect with one of us that are already involved to help you find your place in the kidney community.
Why do you feel it is so important for those in rural and underserved parts of the country to get involved in legislative advocacy?
It is so important for us people that are in underserved areas of the U.S. and communities, and rural America especially. We need to get involved because our doctors, we do have good doctors, but they're so busy driving from clinic to clinic because they don't have the medical staff to cover it efficiently, that we're getting involved in our communities. Like myself, I am part of my local hospital patient advisory council. I'm involved in going to these different conferences like we are today. And I bring back information to my doctor because our doctors in rural communities are so busy, they can't get out to some of these different training sessions. And there's new technologies that we can bring back to our doctors and give them information so that they can see interest. And we need to be asking our doctors, is this something that would help in my care plan? Is this something that will improve my life? And so that's why I stress to each one of you, especially in the rural communities, that we have to get involved, because if we don't get involved, our voice isn't going to be part of what makes us well. And we're the ones suffering. So if we don't get involved, why should anybody else get involved?
Can you share a little about how your engagement with AAKP has helped to guide you and provide support for the advocacy work you do locally?
AAKP is opened a lot of doors, and they open a lot of doors for many people to get involved with different types of conferences different type of discussions where patients can voice their concerns, what they think needs to be changed. They get them involved in different innovations to give the patient perspective, so that these organizations, these pharmaceutical companies, can actually hear what the patients need. They get us involved in Hill Days that give us a chance to connect with our congressional people. For example, in my one of my situations, I found a 17-year-old boy, connected with him, that had diabetes himself, and he hadn't had his diabetic medications gotten to him by the third-party pharmaceutical company in 90 days. And I was having the same problem with deliveries happening. And so I connected with my congressional staff and I said, wait a second, we're trying to fight kidney disease, which is one of the most horrific things that you can go through as a patient. And he's a diabetic, and that's the number one cause of kidney disease. And he's not getting his insulin supplies so that he can do it. My congressional leaders were able to connect with CMS. They were able to connect with the company, and immediately I found an immediate difference happening with that. Another way that I was able to connect with my congressional leaders is during the COVID pandemic. We have 3 dialysis units in Coeur d'Alene, Idaho, that were ran by the same company. CMS had closed one of these units, and I was able to talk to my congressional staff on this and tell them that these dialysis units are so important. And I was able to talk about that this unit that they had closed, if they could open it just to provide a service to patients that had COVID, it would help the patients that didn't have COVID in their clinics to keep COVID from getting spread more in those other clinics. And I don't know if it made a difference, but I can tell you that that third unit opened back up very shortly after that. So I think that each one of us have a responsibility to, one, connect with our communities in advocacy, to help people know about kidney disease. I believe that each one of us have the responsibility to connect with our doctors, our medical centers, to help them understand the patient's position in this disease, and also go a little bit further and become a kidney warrior and a national advocate for other patients. And something as simple as Gloria and I, she has a Airbnb, and the coffee cups in the Airbnb I put in there have AAKP. They have the Ideas conference. I put different kidney organization coffee cups in the Airbnb, and you would be surprised how many questions that I get from the visitors that come and stay in the Airbnb about kidney disease. Something as simple as putting coffee cups in can start a conversation, and each one of us need to find that thing that we can do to bring awareness to kidney disease.
Thank you again, Dale. Rounding out our speakers will be Terry Litchfield. Terry serves as an AAKP Ambassador in Wisconsin. She is a dedicated patient advocate with a background in the healthcare field with an emphasis on dialysis-related care. Terry's late husband, Bill, was on a renal replacement therapy for 46 years, and he was one of the 4 patients who testified before the House Ways and Means Committee leading up to the passage of the ESRD Medicare program. As with Dale, Terry has years of experience as a staunch patient advocate, but she also brings a unique experience, the care partner perspective. Terry, I turn it over to you to share your personal story and experiences on cultivating a relationship where you are seen as the go-to person by congressional and legislative officials.
Thank you, Erin, and thank you, AAKP, for inviting me to present at the 49th annual AAKP meeting. I really tried to think about what was my first AAKP meeting. I think it was 1977 or maybe 78. So I don't remember what year, what number it was, but of course next year will be the 50th. And I have to say, it's a topic today that we'll be talking about, advocacy, that's really important. And it's a really important concept to understand that the original kidney entitlement programs were a result of advocacy, patient advocacy, doctors, citizens. And when I think back to the advocacy things that have been done in kidney care, there have been some really memorable occasions. And I had the opportunity to live overseas, and I got to see advocacy in other countries. But what I have to say, there's nothing quite like advocacy, grassroots advocacy, and engagement of our elected officials like it is in the US, access to everyone. And so that's why I really enjoy this as a topic for us to think about. And hopefully I can inspire some of you to go back and take some of these tried and true tips back to your communities, your state, and joining in the national level to ensure that kidney patients are afforded the opportunities that they all deserve.
Thank you, Terry. I'd like to ask you a few questions. You have such a long history of involvement with AAKP. Looking back on your journey as a patient advocate, do you remember how you first became engaged in advocacy?
That's an incredible question, and it's probably one I've not shared with anybody. When I was in high school, my dad suffered from kidney failure, but I was engaged in a junior women's organization. And in those days, the National Kidney Foundation actually sold Halloween candy. And I decided that year, our fundraiser, we were going to sell candy for the National Kidney Foundation. And we set a record. We sold 2,000 pounds of candy. And so I got this invitation for that next March, it was 6 months later, to join the National Kidney Foundation in their Capitol Hill days. I couldn't believe it. I was going to go to Congress. I was going to go and see our legislators. I was so excited. So I remember that so very well, because here I was the only kid amongst a number of really what I thought were very distinguished adults. And we were on Capitol Hill. We were meeting with various congressmen. I'm from the state of Louisiana. So we got to meet with the congressman from Louisiana, but we actually got to see the Capitol. We got to see the legislative aides. And it was really momentous for me, because I just thought, wow, all I did was have a Halloween fundraiser for a club I was president of. But it really left a moment to me. It really made me realize that regular people can actually influence, and I'm going to call them politicians, but they really are our public servants. And I never realized how approachable they could be. And the fact that I learned at that time that they had local offices and state offices. So it really did open a door for me that I have walked through my whole life, understanding what the value and how the patient voice can be a very strong one. I will recall that in those days, one of the things that we were talking about on behalf of all patients was more accessibility to transplantation. Some of these issues have just probably never gone away. There were not enough kidneys then, just as they are now, not enough kidneys. But, it was just a wonderful, wonderful day. We were there for 2 days, but there were doctors, there were nurses, social workers, patients, transplanted patients, patients on dialysis. And so that was really my first experience at advocacy in any space, but certainly it was the kidney space.
What advice would your late husband, Bill, give to those who want to get involved in legislation and advocacy?
I know right away what he would say. He would say, vote, register to vote, exercise your right as an American to vote. Because he always believed that that was fundamental when you're going to engage elected officials. Because believe it or not, they know who their voters are. They will sometimes ask, are you a constituent? That means, do you live in their district? Because that matters too. And I think he was always good for a history lesson. For those of you that don't know, it was kidney patients along with doctors and corporations and insurance companies, but it was kidney patients that testified before a congressional subcommittee that really helped pass the Medicare legislation that covers all kidney patients, regardless of their age, with Medicare. And so he was a real advocate. He was tireless. And he was at that hearing. They went back to follow up. And he always, whatever state we lived in, he would always make sure that our local legislators, when we would move house, one of the first things he would do is set up an appointment with the legislative aide for health at the local home office. And when there were any types of political rallies, he would go. And if there was a particular platform that he was interested in, like if there was something there was going to be a cut in, let's say, a state Medicaid program that would involve transportation services for dialysis patients. That's one I remembered in Houston. He would go to all of the public hearings and he would stand up. He was rarely a named speaker, but there was always a chance for the members of the public to share their voice. You don't always have to go in person. You can write letters. All of your legislative officials, particularly your congressmen, have websites. And I think he would tell you to do what you can, but know who your congressman is, know who your state legislator is, know who your governor is, and make sure that they know who you are and the fact that you're a kidney constituent, and identify yourself as that. But again, I think he would say over and over again, vote and register to vote, and encourage your kidney community friends to do so. There are also, was a great believer in organizations like AAKP. In the early days, when I was a first member of AAKP, it was called NAF, the National Association of Patients on Hemodialysis. And it was it was a working situation where I got to know AAKP. And it's really important that you find out what is available and who represents you. Maybe you're from a small town. And even if you're from a small town and even your state representative doesn't have an office, it's usually not very far for you to drive and to go and see their office. You call ahead and make an appointment. And if you are ever visiting your state capital or the capital of your state, call in advance, ask to see, ask to meet, ask to be part of the process, ask for a tour. Those are the things I think he would give you advice to do for you and your town and your state. And then as the opportunity arises with the organizations you get engaged in, give it a hand at the national level too.
As a care partner, why is your voice and perspective so important and needed?
As a care partner to a longtime dialysis patient, I always felt it was my role to not just be supportive of his care, but to also share my voice about what other care partners were feeling or experiencing, or things that could be done to lessen the burden for care partners, but also to show that kidney disease is a family disease. And that's a really important concept. And it's always been my experience when Bill and I would be together at any type of advocacy event or meeting, that we show that united front. Because again, the whole family gets impacted by kidney disease. And in a transplant situation, there are a number of care partners who actually donated a kidney to their loved one. And that is a real, I've been in meetings where I've actually met some congressional aides who had donated kidneys. And that has a wonderful connection factor, so that as a care partner, you can share stories and you can talk about other families. And it shows that it's not just a single patient, that there's a family unit involved here. And sometimes patients aren't able to do all of the things that you are able to do. And to share that and to make the reality and to make the human side of kidney disease shown by a spouse, a care partner, a daughter, or a son is really important, so that our elected officials understand it's not just 500,000 patients on dialysis in the country, but it's 500,000 patients and their families and their friends. And so the ripples spread when you accompany patients, when you advocate for patients. And sometimes there were times for my husband when he would be actually too busy to do some of the activities for advocacy, and he would wish me well and send me on my way. And so that's the thing, that it's you do it together. It's kind of, I'm going to say, it's kind of like a hobby, and you feel such satisfaction. I'll never forget the excitement when finally, after years of advocacy and lobbying, Congress finally passed legislation that covers the immune drugs to prevent rejection for kidney transplant patients. It had historically expired after 3 years of your transplant, and it's now for a lifetime of that kidney. And so the excitement, I was one of thousands of people advocating for that for years, but I felt a personal pride in it. At a family level, we felt a great pride in accomplishments like that.
Thank you again, Dean, Dale, and Terry. We appreciate your dedication to AAKP and applaud your efforts to raise awareness and affect change for those impacted by kidney disease.